As the temperatures drop, the increase in the number of cold and flu cases begin to climb. Although this year we have a new player on the field called COVID-19, the threat to people with respiratory issues and people who use assisted devices to breathe is always high. However, there are some simple and easy steps you can take to lower the risk of acquiring a respiratory infection. One of the best ways to prevent the spread of viruses and bacteria is by washing your hands. It is a simple procedure which takes very little time, but the benefits are enormous. I know, it is much more convenient to rub hand sanitizer on your hands, but hand sanitizer does not kill the flu virus and does not kill many bacteria which can cause respiratory illness. Hand washing is also much more effective at killing the coronavirus than hand sanitizer. It is recommended you wash your hands for at least 20 seconds with soap and water, and wash them frequently. The CDC recommends washing your hands before, during, and after food preparation, before eating, before and after caring for someone who is sick, before and after treating a cut or wound, after using the bathroom, changing diapers, or cleaning up a child who has used the bathroom, after blowing your nose, coughing, or sneezing, after touching an animal or animal waste, after touching garbage, and also washing them if your hands are visibly dirty or greasy. If you must use hand sanitizer, make sure it is at least 60% alcohol. Sanitizer with less than 60% alcohol is very ineffective at killing anything. Also, if you use hand sanitizer, at the first chance you get, please wash your hands. I have a rule that if anyone is going to touch my ventilator or touch my tracheostomy tube, he must wash his hands and also put on gloves. I have had many hospital-acquired infections, most of which were from bacteria that are resistant to hand sanitizer. Respiratory therapists, doctors, and nurses would enter my room and they would lather up the hand sanitizer, but I would often still pick up an unwelcome souvenir, a respiratory infection. When visiting the doctor's office, insist the medical professional washes his hands. If he just uses hand sanitizer, you are at a much higher risk for contracting illness. Whenever I take my ventilator to the doctor's office, emergency department, or hospital, I always sanitize my ventilator as soon as I get home. I know these hand sanitizer wipes will not kill everything on my machine, but it helps cut down on the number of germs which I bring home. I also wash all my tubing and anything else which can be washed. I place hot water, mild dish soap, and my equipment into a wash basin. I then let the equipment sit in the hot, soapy water for at least 30 to 60 minutes. I then swirl around my equipment in the water and thoroughly rinse off my items. I then let them air dry. One of the most effective ways to prevent becoming sick is by having a strong immune system. Vitamins and minerals can help. A number of scientific studies have shown that 2,000 international units of vitamin D is more effective at preventing the spread of the flu virus than the flu shot. Since most people are vitamin D deficient, it may be worthwhile to get your vitamin D levels checked at your doctor's office. Also, ask about supplementing with this vitamin. Moreover, zinc is an essential mineral needed to help your body mount an immune response to a virus. Studies have shown that 20 to 50 milligrams of zinc daily helps give your body the needed zinc to assist in fighting off viruses. Vitamin C is also very important. Dark leafy green vegetables, tomatoes, and citrus have good levels of vitamin C. You can also take vitamin C in a supplement form. As always, check with your doctor before starting any new supplement. Using any assisted device to breathe can dry out your airways. As the temperature drops, the ability for air to hold moisture decreases. With this being said, the air you breathe in is drier in the cold months than it is when it is warm outside. Even with a heater and humidifier on my ventilator, my airways tend to dry out in the wintertime. An important thing to know is that when your airways dry out, the mucus in your airways dry out. Mucus is an important defense system in your body which helps trap bacteria and viruses. When the particles are trapped, it prevents them from traveling farther into your body. Once the invaders are sequestered, your body can move the trapped particles up and out of your respiratory tract. The mucus is often gotten rid of when you cough, sneeze, blow your nose, or swallow. If your mucus dries out, a very important branch of your immune system shuts down. To keep your airways moist, make sure you are getting enough fluids throughout the day. Most in the medical field say to get 2 liters of fluid a day. In the wintertime, it is probably wise to get more than 2 liters daily. However, check with your medical professional to find out how much fluid you should intake daily. Another way to keep your airways moist is to run saline through a nebulizer. This saline will help rehydrate your airways and will moisten the mucus. This will facilitate your body being able to get rid of any germs in your respiratory tract. I find running 5 milliliters of saline through my nebulizer daily tremendously helps. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.